Hi, glad you could join us. I'm Annette Sherman. This is Community. It's a special program today. The reason it's a special program is because the topic, I know because I know the statistics, the topic is falling when you don't want to fall. It's not like falling in love, it's falling down and probably breaking something that you don't want to break because number one, it's painful. Number two, it could cause, well, I don't have to tell you because I've got the specialist here. My special guest is Dr. Jason Collins, and Dr. Collins is with Intercoastal Medical Group. He's also with the Pines of Sarasota, working with them on various programs having to do with falling and preventing falling. And he is a doctor with intercoastal medication. I'm not sure how they're referred to, but the intercoastal physicians that form Intercoastal. I got there, but it was a hard trip. Let me introduce my special guest, Dr. Jason Collins. And I know that you've planned to be with us and made the arrangements, and I'm delighted that you can, because very often my viewers will tell me when I have a physician on, oh, I'm so glad I learned so much. When are you going to have that program on again? Because they tell me that they know that you can only, I don't mean you, but physicians can only spend a certain amount of time with their patients. And they don't want to trouble them with questions that are going to take additional time. So when we have a physician on, I usually get a tremendous number of calls and requests to repeat the program. And if you want that information, if you call me, I will tell you, because we will be repeating this program. All right, Doctor, talk a bit about your background and training.
Okay, great. Thank you for having me today. I'm an orthopedic surgeon. I have a subspecialty in sports medicine, but I typically treat most orthopedic problems. I'm originally from Fort Myers, just down the road, and went to University of Florida for college, and then trained at New York University for medical school, and also did my orthopedic surgery residency at New York University.
I'm a New York University person too, but I was in drama and theater and television at that time. But you were among the doctors. We'd watch for the doctors to walk by and maybe meet them, because they were all very attractive, and obviously they were immersed in their studies and not terribly interested in much else for a while, at any rate. I know that you're relatively newly married.
Yes.
Because when I met you the first time, you were late, and they kept telling, don't worry, he'll be here, he'll be here. And I was wondering why they were so sure. And you walked in, and you had a big smile on your face, and you said you were so sorry to be late, but you were on your honeymoon. Well, what a good reason. And now that honeymoon has blossomed into an 8 months, how old is he, your son?
Almost 6 months now.
Almost 6-month-old son. And we didn't bring a picture, but next time I have Dr. on, I'll insist that he bring a picture of his adorable little son, who will probably be at least a year old at that time. Doctor, let's talk about, well, talk to me about your training and your background for a minute or two.
Yes, so typically to become an orthopedic surgeon, it's 4 years of medical school after college. While you're in medical school, the first 3 years are generalized, and then the fourth year you can start to focus on your specialty. So I did several months of orthopedics at that time. Then it's a 5-year orthopedic residency where we learn all types of orthopedics, hand surgery, fall type injuries, spine surgery. And then when you graduate from that, you can do a fellowship or a subspecialty. So I went and treated sports injuries, traumatic injuries, a lot of arthroscopic type treatments. It gives you a nice broad exposure to everything. And then now that I'm in Sarasota, joining Intercoastal, we have a lot of needs for general orthopedics. So I'll treat falls and take emergency room call, but also do sports injuries, joint replacements, things like that.
Well, I know when I fell, and this is When were you married? How many years ago? 2 years ago.
Yes, a little less than 2 years.
Okay, so it's about 2 years ago, and broke a bone in my shoulder, and my primary care doctor is with Intercoastal, Dr. Lee Harris, and recommended, highly recommended you, doctor. And I did see you, and you looked at it and examined it and had your people take x-rays, and you gave me the good news that I did not need surgery, which of course was wonderful news because I know that typically that it would. But apparently that did not, and you wanted to see me again in a period of time, and you did, and you checked on it and checked on it again, I think 3 or 4 times. And each time it was healing, and you were pleased, and no more than I was. But it turned out to be absolutely wonderful, and you were a wonderful doctor, and I'm very lucky. Let's talk about statistically the number of people, the percentages of falls with an older, we have an older population. Over 65 is not unusual, over 85 is not unusual. So talk about statistics, doctor.
Sure. Well, like you were saying, anyone can have a fall and anyone can get injured from a fall. Over 65, there's about a 1 in 3 chance of suffering a fall.
1 in 3.
Yes.
Well, that's very, very frequent falling. Okay.
And then approximately 1 out of 5 falls results in a serious injury, meaning a life-threatening injury or an injury that may need surgical treatment or some sort of intervention. So again, it's very common to have a fall. Being in Sarasota, I've treated patients from 1-year-old. My oldest patient with a hip fracture was 104 years old at Sarasota Memorial Hospital.
Falling. Okay. It seems like falling is almost not preventable at a certain point because there's always some dumb thing in your past, whether it's in an area where they park cars, and that's where I was, or it is in your home. So let's talk about prevention and some of the possibility. Wait, before we talk about prevention, you mentioned some general statistics, specifically the hospitals that we know. What percentage would be falls? Do you have a percentage number?
Well, just in general, 50% of emergency room visits are some sort of musculoskeletal related issue. So falls are a high percentage of that.
50%?
Yes.
A high percentage of that resulting from falls?
Yes.
Oh my goodness. Okay. There must be, and I know that you've told me there are many things that one can do to hope to prevent falls. And I guess the more aware we are, probably the luckier we are in preventing a fall that can kill us, maim us, cause surgery, and certainly do some very unhappy things to our happy existence. Okay, what can we do to avoid a fall?
Okay, so most falls occur at home.
They do.
Yes. So the number one thing to do, and a lot of that is most people spend most of their time at home, so they're at a higher risk for falling where they spend most of their time. Some of the simple things we can do around the house is make sure our floors are clean and free of debris, make sure that rugs are well fastened and there's not a lot of uneven surfaces, door frames, things like that don't have bumps there. A lot of it is wearing the appropriate footwear. Being in Sarasota, I joke around with my patients because everybody likes to wear flip-flops or sandals that don't necessarily...
Not good. That's not good?
Well, they don't have as much support as a normal shoe, so you just have to be careful about that. And the flip side of it is I have patients that wear high heels. Some of them aren't the steadiest patients, and sometimes the high heels can be hard to balance in. So making sure you have appropriate footwear. Usually for casual walking, I just recommend a comfortable sneaker, but that can help prevent falls as well.
So check your home for obvious problems that may be, somebody, I was reading somewhere, I'm interrupting myself, my late husband said that's the only way I get to be interrupted. Some people say that that pets cause falls, and I thought back, I think of two friends of mine who broke their ankle running after their dog.
Yes, that's absolutely true. I've definitely seen a number of patients who have had pets. Sometimes people are walking their dogs and the dog pulls on the leash, causing them to fall. And a lot of times, especially with the smaller dogs that people have in their apartments or condominiums, they can lose track of where they are. The dog can run in between their feet and cause them to trip and hurt themselves. And the corollary to that is, when I talk to my patients, sometimes grandchildren can be even wilder than pets, and sometimes they can come visit and get in between your legs or trip under your feet and cause an injury as well.
Okay, so this is something that they have to be aware of when there is a situation where the pet is running and you want to stop him, or you want to pick him up and he doesn't want to be picked up.
Yes.
So that this is a cause for falling and a cause for probably breaking something. Okay, so your home, you started to say, is one of the first places you want to look. Your shoes, and you indicated that some women like high-heeled shoes, which you're not advocating.
Well, I'm not against them. Obviously, it's very good to be fashionable, and I have no problem with the fashion, or even sandals going to the beach or walking around your yard. But I think the main thing is to just be aware. If you're going to be in a new place, a place with unsteady surfaces, try to wear footwear, or at least be alert when you are wearing footwear. If you're wearing high heels, maybe don't have that last drink at the end of the night, and be more cognizant of where you are. Use handrails or tables when you're walking around, things to brace you.
What is, I know what the word balance means, but what is balance when we're walking to help your balance? I read that in material that of yours and of the Pines, who has a wonderful plan. It's a free thing. Let's put that number on the screen that people can call the Pines, and they can get you there because you're there.
Yes, so I'm the medical director of the fall prevention program there, and it's a fantastic opportunity. They have a free fall evaluation where they'll evaluate your balance and your strength. They'll even, if you're within, I think it's about 10 to 15 miles, provide transportation if you call there. And what they do is they test your balance, your strength, and if there's any issues, or if you have a high risk for falls, they will often recommend rehabilitation or physical therapy to help get you a little bit stronger.
Okay, let's put that number on the screen, please, Joe, to call the Pines, and I should have the number here. I don't have the Pines number, or if I do, I don't see it. It's on the screen. The Pines is 5. Can you read that, Doctor?
Sure. 941-552-1882.
Okay. And you can look it up if you don't have a pen or something to write with, or you can call me, but you can find it easier on the internet or wherever you want to look for the Pines. And it's conveniently located in Sarasota. They have the program going there that will help you. And I think it's a free program to check out your balance and to see what you need, what area you need help in, and it can help. I know, because I know not quite a few, but several people who have gained, if not total understanding, a greater understanding of the idea of not falling, of preventing falls, and that's what you want to do. Okay, so the Pines is one place that offers information about how balance. How would you describe good balance?
So good balance is being able to walk with strength and with stability from one place to another. Some of the issues we run across with balance is as we get a little bit older, our muscles weaken. Sometimes we can have issues with arthritis where it's painful to walk or we're not walking like we normally would. So helping to treat the arthritis or helping to get a little bit stronger will often help you walk with a stronger, more steady gait.
Also, there are obstacles, objects. I know that I've heard people tell me, and I've almost fallen several times, and I train myself to look down see if there is anything on the ground or that I should know about that I don't want to trip over. So this kind of thing, I'm not a professional, but that is, and he's shaking his head yes, because you have me on the camera and not our handsome doctor. Okay, so the Pines has this wonderful program going, and that would be a good number one, to check yourself out and
Sure.
check out your balance.
Yes.
Okay, then to improve that balance, there are wonderful things that can be done that are also through the Pines, or do you work with your patients?
Well, yes, there's a number of different things we can do. A lot of my patients don't necessarily even need a formal physical therapy program. So typically in the office, we give them some exercises to do to strengthen their legs and upper extremities. I tell patients just simple exercises, going for walks every day. Swimming is very good. There are a number of water aerobic type programs in this area that patients can go to. And just staying fit and staying strong will often help your balance and help you avoid injuries.
Okay, so that generally speaking, keeping fit, keeping aware, I'm just reiterating what the doctor said, aware of what is on the ground and what is on the floor in your home so you don't trip over a plug that someone pulled out of the wall and left on the floor. Or if you have pets at home, running after them. This friend of mine ran after that broke her ankle in her socks. And we didn't realize, of course, she wanted to catch the dog. And what happened was that she slipped on the floor wearing just socks instead of slippers with a rubber bottom. So that can happen. Be careful. Think about that. Think about the fact that statistically, 65 and over in our community is populated by people 65 and over. So it's probably many of my viewers. Be careful. Take time to check out where you're walking, what is there, whether you're on the street, whether you're crossing the street, whether you're just walking happily and you've had a drink or two, which I guess is a deterrent for not falling. So it probably loosens your sensitivities and your realization of what's there. Okay, I want to mention, more than mention, that you are affiliated with Intercoastal. And put that number on the screen, please, Joe, the Intercoastal number that you can get hold of our dear doctor and Dr. Collins, Dr. Jason Collins. And I didn't see the number on the screen. Did it go on the screen? It did? Oh, there it is. Okay. Is that the number for the Pines, or is that the number for Intercoastal?
No, this is the Intercoastal number for my office.
That is the Intercoastal. I want to put it back, please. Put it back on the screen, Joe. The Intercoastal number that you just had. Okay, fine. And that is where you find Dr. Jason Collins. Collins is the doctor's last name, so you can find out when he's there if you want some information, if you want an appointment, want him to check you out if you've fallen, or if you haven't fallen and you don't want to fall, to check him out. So call the Intercoastal. You're there most of the time.
Yes.
And you also are at the Pines for this program that you work definitely there as well. We had some pictures that we had one picture we cut back because, believe it or not, we're almost out of time. And that's hard to believe because it seems like we just started the program. Okay, Dr. Jason Collins, and Dr. Collins is the orthopedic surgeon, and he's also involved with sports medicine. And he can be found at the Lakewood Ranch office of the Intercoastal organization, wonderful organization. And that number was on the screen, I think. It's 362-8662. 362-8662. And the Sarasota office, which is on South Beneva Road, and the number is on the screen, the general number is on the screen, which is 955-6748. And you can reach Dr. Jason's office, Dr. Collins, not Dr. Jason, Dr. Collins' office, from either of those numbers. And don't wait. You may want to be checked out for balance, and that's the Pines. But if you call Dr. Collins, he can probably help you arrange your time at the Pines for your testing to check out your balance and see if you need help. And they offer a free service.
Yes.
So that's wonderful. But your son is not walking yet.
No, he's just starting to crawl.
Oh, he started to crawl. Well, freedom is over now for you and your wife, because they are, it's a marvelous thing. At that age is just so delightful when they start to talk and walk. And your parents are here in Sarasota?
Yes.
I would imagine that they spend a great deal of time. What is your son's name?
Hudson.
Okay,
Hudson Collins, yeah.
Hudson Collins, lovely name, really a lovely name, and he's going to be a handsome young man, probably a doctor or a lawyer. Okay, we hope we've been to some help to you. The main thing is that the statistics on falling are incredible and seem to be getting worse. Maybe it's the fact that we're living longer and that we don't take the precaution that we should. However, I think once we get the habit of checking out where we're going, of looking down and seeing if there's something in the road that we're going to trip over, I know I do that very often now, and not in that much of a hurry to get anywhere, that I can't take a few minutes to see if there's something, a problem. The shoes are a problem. No, seriously, doctor, because there is, what you would recommend, tell me about the shoes you'd recommend.
Typically a comfortable sneaker with a rubber sole to help from slipping on wet surfaces that provides a little support around the ankle as well. And just something you feel comfortable in when you're walking, so that you can focus more on where you're going and your balance, rather than trying to balance on a shoe or not have any of that ankle support that you may need.
Now, do you perform surgery?
Yes. Okay,
so that not just with a fall, but with other problems in orthopedic surgery, that is another whole area. And so that the fact that surgery may be needed, it also may not be needed. And it was Dr. Collins who told me that surgery is not needed in my case. And I wasn't jumping up and down, but in my thoughts I was jumping up and down. So happy to hear that. And your people were wonderful. The exercises that I was given were wonderful. And I really, in practically no time at all, I felt fine and was able to do everything I wanted to do, so that I was very grateful to you and your people, and good luck, I guess. That's the main thing. Okay. Don't be a statistic. The people who fall make up what percentage in the hospital waiting room?
Almost 50%.
Over 50%. Wow. Wow. who are risks for falls, and that's 1 in 3 Americans over the age of 65. 1 in 3. That ain't too great a space. 1 in 5 falls result in what? I can't read that.
Serious injury.
What injury?
It's a type of serious injury.
A serious injury, 1 in 5. 300,000, well, you can read from where you are better than I.
There's over 300,000 hip fractures per year in the United States.
Now, a hip fracture can be a serious thing.
Yes, so typically when someone has a hip fracture, they're not able to walk afterwards. So it almost always requires a hospitalization and usually a surgical treatment to stabilize the hip.
Of the percentage, I don't remember. Was there a percentage of people who fall who have hip fractures?
They don't have the exact numbers, but I would say probably about 10% of people over 65 that fall can sustain a hip fracture.
Which is serious.
Yes.
Okay, any fall is going to be serious because it's going to need medical advice and a good doctor to tell you what has to be done so that you make a complete recovery. Doctor, I can't tell you how grateful I am. I know how busy you are. It's very, very difficult to nail down a time where you can be with us. I will be repeating this program, and if you want to know when, you have to call me, and you can call me at 365-7052, 365-7052. If you were unable to take down these telephone numbers, call me at 365-7052 that's on your screen now. I will give you the numbers and names. And our handsome and wonderful doctor today is Dr. Jason Collins, and he is an orthopedic surgeon and a sports medicine physician. And I'm very grateful to you for taking time out to be with us today, and I'm sure a lot of people out there are also grateful. We've got about 30 seconds. I'd like to remind most of you that we have a new program for you each week, and now we are excited to tell you that we're also on YouTube. And you can see this program or any of our programs anytime on YouTube. But it's not just people here on YouTube. It's anywhere in the world. So the message is out, Doctor.
All right.
And I thank you so much again. Bye-bye for now.
The time really flew. We bid you adieu from community. If you want to know why we love it here, so check out Community. Well, it's a who's who, a what's, when, and where show. It's a mover and shakers who